Put
You're live.
here. We're going to be doing, hey guys, we're in Midtown Manhattan and we're doing a great treatment today. Some people call this the vampire facial because it was popularized that when you do this needling, there's a little bit of bleeding on the skin. And you can see the fine pinpoint bleeding that occurs when we're doing this collagen induction therapy, or what we call microneedling. You can keep going, I don't mind. You just keep, and our amazing assistant Rachel here, who is an expert in lasers and education, is applying what we call the liquid gold, and this is growth factors and sort of stem cells and anti-inflammatory ingredients from your own skin cells, or so your own blood cells. And you can see we're pushing that into the skin. Now, he has some textural issues on his skin, which is why he's probably wanting to do this treatment. And if you continue to do this treatment over time, you're going to get more and more improvement in your skin quality. The most important thing, however, I always tell people, is that you want to combine this. If you want bigger results, you need to combine this with laser treatments. You need to be doing aggressive skincare afterwards, like retinols and bleaching agents to improve the skin quality, and stem cell products, but also lasers. So we will very frequently do a CO2 aggressive laser on someone like him, a Fraxel laser where there's a little less downtime than the CO2, but it would improve his scars more if we were focused on the scars. If we just wanted to keep him a good looking young guy, he can keep doing these microneedling treatments and get a nice improvement. Now some guys' skin's a little thicker, so we're gonna go, how's the pain here?
Oh, it's fine.
It's not too bad, right?
Not bad.
What is it, tell people, what does it feel like?
It's slight pinpricks, but mostly just a vibration.
Nice, okay, so well that's good. So it's almost like a little massage. A little massage is better than torture from needles. So one of the things we're gonna do is we're just gonna do even passes. We're gonna zoom over here now too. Turn your head to the right a little bit so we can kind of show them in a good angle there. And we're getting all this PRP onto the skin because it's really gonna help it rejuvenate.
The recovery time.
Depends on how many passes you do and how strong you go. Guys have thicker skin, so in general I like to do numerous passes till we get to at least some level of pinpoint bleeding. I want him to get a good treatment, so probably 3 to 5 days of some light redness, some mild pinpoint little spots. I usually tell people we need to be doing a vitamin C, a glycolic cream, a retinol, and some sort of lightening agent on the skin right afterwards to improve the quality of the exfoliation that would occur from the microneedling. But remember, this is like a workout. I call this skin gym, okay, you guys? This is the skin gym. And this is, again, if you don't go to the skin gym, your skin doesn't look good. Just like if you don't go to the regular gym, your body doesn't look good. So this is something you would do regularly. If you wanted a bigger improvement, we need to do lasers, microneedling radio frequency, like something called Fractura that does needles with heat. And we're going to do a little different technique. We're going to do a little pulsed technique where we stamp on the skin. And that's going to allow us to go a little bit deeper in localized areas. You might feel this a little more in gauze around his eyes. We're going to go over his scars and sort of stamp over the deeper scars because he really wants improvement in texture in that area. The overall rejuvenation we've done. But you see now in this area, he's going to have a lot more bleeding, so some crusting and scabbing, potentially very mild. But he's going to get more out of it. Turn it this way. I'll show you guys here. He has one bigger scar over here that we're going to treat.
What improvement is expected?
Well, I don't know. There's no real improvement level that we're talking about here. It's skin gym, so this is something you need to do regularly to keep yourself looking good. For him with scars, I always tell people you need at least 6 to 10 treatments before you really start to see improvement in scars. If you combine this with lasers, you see a much faster outcome. And that's really, I mean, that's really it. I don't suspect. Now this you feel a little bit more, right? Yeah, I figured. Everyone always feels this part a little bit more, especially if someone had like fine lines around their mouth. This would be good. I'm kind of doing this preventatively. We usually do 2 passes here. You can see much more bleeding when we're doing this treatment, like this level, especially around the bone over here. So turn a little bit to the right again. I'm going to show them here. He has some nice thick scars here, so we really want to try and improve them. Now we're going to lower the setting in a second. And so the redness isn't so bad. You just want to make sure you hydrate. We use growth factors and stem cells afterwards, and obviously he's doing his PRP, which is a added benefit. Okay. I'm going to go down a little bit, put a little bit more, because you can apply all the PRP now. Just go ahead and apply it all throughout. We're also going to put a little bit of a hyaluronic acid-based serum on the skin, which is a natural sugar that's in your skin regularly to help it plump. And we're going to do one more light pass, specifically and going over his nose, so we get the pores. And just blend everything. One thing I always tell people is it's nice to go right up into the eye. Everybody hates dark circles. Everybody hates the fine wrinkles there. Couple passes up right into the eye. Crow's feet area. Again, pull that down, go right up into the eye. Couple passes. And just blend, blend, blend. Do a nice circle technique to get everything blended. How do you take care of your skin regularly?
I have a face wash that I use that is non-alcoholic, non-soapy, and then I also use retinol nightly, but that is about it.
All right, well, we're going to integrate a couple other things. So vitamin C's, very important, especially for men, because of sun damage and risk of skin cancer. We want to have an antioxidant. Glycolic cream to help exfoliate your skin and boost your retinol's results for fine lines and wrinkles, and also pigmentation and sun damage. And then at nighttime, you want to have some sort of anti-aging product. Growth factor, stem cell, or peptide. Yeah. So those are the things a young guy needs. And we'll talk about that. And your cleanser should have one that's active, something with a glycolic or a salicylic acid, so you actually exfoliate or treat any acne that people could get sometimes, but also something that's foaming and cleansing, exfoliation type. Now, that's a good outcome. What do you think?
I love it.
So now if you guys see diffuse pink on his skin, we rub in the blood because we don't want to lose any of those stem cell factors. He'll usually under the eye, you'll get a little bit of redness and some marks there because the skin's a little thinner and the nose pores, but this is the result we want to see. We got all the PRP on there,
Yep.
And then the only other thing we want to do is, add a little bit of the hyaluronic on here, and we're going to add a growth factor serum on there, and then he's done. And that's it. That is microneedling with PRP.